Let's talk about HCG and its decline. So, when does the HCG decline in levels after you've administered it? Once you give HCG as an injection, that is to trigger ovulation, urine pregnancy tests may remain longer due to the concentration of HCG in urine. So, let's look at the blood HCG levels after 5,000 of HCG trigger being given. And one study found that the HCG levels did not decrease to negative until 8 to 12 days after injection. Another study showed that the rate of HCG decline varies according to the initial concentration. For example, if you had 10,000 given, it takes longer for the HCG to decline. And if you have a look at the HCG levels, when you give 10,000, it typically peaks over 200 to 250 international units per liter at 12 to 14 hours post trigger. Now, that's something which keeps the HCG levels much higher in terms of when you give 10,000. So, what can influence a slower decline of HCG? One is increased BMI, and higher BMI is associated with lower HCG levels after trigger. Older patients may have a slower HCG decline, and there's a wide individual variability in early phase HCG concentration. So, what is the recommendation? That if you have had a 5,000 HCG trigger being given, then do not test it at least for 10 days, ideally 12 days after the trigger. The blood HCG level typically drops below 5 between 8 to 12 days, and that is generally for a 5,000. And the reason why, because if you give HCG and you do a blood test much earlier, the false positive, that is the chances of it coming positive to 10 days after administration, may be a bit higher. And this gives a false idea that you're pregnant. And this is probably because the body takes time to metabolize the injected hormone. The rate of decline varies between individuals. Thus, I would generally suggest that if you've had HCG trigger for ovulation induction, do not try and test for pregnancy for at least 12 days after the trigger.